My name is Jonathan Keytel. I work for a company called ROCHE Diagnostics. And we are actually, you may not know much about us, we are actually the largest biotech company in the world when you combine the diagnostics and our farm divisions. And actually, we recently celebrated our 125th birthday, so we've been around for some time. Here on the African continent, we have been present for about 70 years or so, and we're present on the continent in about 40 of the countries. So we've got a fairly broad presence, and we have about 850 employees. So fairly large enterprise. I lead a function called Healthcare Transformation and Sustainability, and my role and my team's role is really to co-create and co-shape healthcare systems, particularly laboratory systems, with a focus on then creating access for patients to healthcare. And what I'm going to talk about today really is very much the role that diagnostics plays. On one side in creating access to healthcare, but also I believe, the role that diagnostics, but not just diagnostics, but medical information in general, the role that plays in improving the lives of the patients we serve, but also in terms of driving long-term sustainable value for healthcare systems. So I hope to cover those topics today. So I'm going to start off by just introducing, what exactly is diagnostics, and what do we mean when we say diagnostics or laboratory diagnostics. And I must say that the COVID pandemic has certainly pushed diagnostics very firmly into the spotlight. I can remember a few years ago that it was sometimes difficult to explain to people exactly the field I worked in, because laboratories are often considered to be closed off facilities, often in the basement of the hospital. But I must say COVID has certainly pushed us into the forefront. So you might have heard, if you're familiar with COVID, you've probably heard the word PCR used a lot. This is a type of test, and in fact that is one of the key branches or sub-disciplines within diagnostics. And PCR basically is a technique that allows us to detect the actual genetic material of an organism. So it's a very powerful technique, for example, for diagnosing something like COVID-19, because you're actually looking for the presence of the virus. But it, of course, can be used for a multitude of applications. And we see a lot of utility also in related areas like sequencing. So I'm sure you've also heard of sequencing. And this is really helping us to develop better medicines in time, but also to characterize diseases better, like cancer. Linked to that is another area that we see a lot, is immunology or serology. Again, I'll use the COVID example. So if any of you have had a rapid diagnostic test, it's kind of a strip-based test. It uses a serological methodology, which basically means we're looking at the antibodies that your body is producing against the disease-causing agent, in this case COVID. And this is a very powerful technique which is used to understand infectious diseases, but it can also be used to understand how the body is reacting to the environment. So thinking of things like autoimmune disease as well. Moving counterclockwise, hematology is a subdiscipline that looks at is the study of the itself. So a lot of disease is linked to abnormalities in our blood itself. So things like if there's anemia, so if you don't have enough iron, this can be seen by studying the blood itself. Clinical chemistry at the top is probably one of the bigger areas, and where a large number of diagnostic tests are situated. And this area looks specifically at how do we measure the various molecules and the biochemistry of the body, essentially. And if you become unhealthy, then often one or more parameters may be out of their normal ranges. And this information is very powerful then in helping to understand disease, but also helping to understand kind of whether medicines are working, whether they're causing side effects, etc. The blue block is histopathology. This is quite an interesting area of diagnostics. And this involves looking physically at cells from the body. So these could be physical tumors, for example. So in the case of cancers, where you have a physical tumor, it could also be individual cells. So thinking of blood cancers, for example. And this is a very powerful area of diagnostics, and is really, there's a lot of additional technology that is being developed in this area to diagnose cancer and really characterize cancer and tumors. And then finally, microbiology this is really the study of the bugs themselves, so bacteria, fungi, parasites, etc. So any organism that might be causing disease is studied under microbiology. There's obviously, this is a massive science, a massive branch of medicine. We could probably spend a couple of hours talking about it, but hopefully you have just a feel now for what it is exactly that diagnostics is. So then getting in a little bit more into the topic at hand. And this is a very simple drawing. It kind of tries to show the idea that if you consider the blue line to be either perhaps the patient journey, as we would think about it, so the path that a patient takes through the healthcare system, perhaps related to a single disease. You might also think of this as something like the continuum of care. Across that continuum of care for a disease, you can see that there are multiple opportunities for clinical touch points, but there are also multiple opportunities for diagnostic touch points. And the obvious one is diagnosis, but there are also utility of the technologies for screening. So understanding whether a patient might be at risk for a certain disease. And a great example here is cervical cancer, which is caused, most cervical cancers are caused by a virus actually called human papillomavirus. And so there are assays available to actually screen women to understand whether or not they have an infection with this, with human papillomavirus, and particular high-risk types that have then been associated later with the development of cervical cancer. And so the power of a screening test is really that you can stratify patients who are at risk of developing disease or may already have disease from those who don't. And so that's quite a powerful utility for diagnostics. Diagnosis itself, so this is probably the biggest area where diagnostic assays are used. This is really about figuring out if someone actually has a disease. And here we would leverage a wide array of different technologies and techniques based on the diseases. But a good example of this from our own experience within Roche is around cancer diagnosis. So being able to diagnose not just that a patient has cancer, but also then to specifically detect biomarkers that are able to differentiate what type of cancer it is, and even subtypes within the cancer, and then being able to understand which medications will work. And so this is an area of diagnostics that we would call precision healthcare, where we would basically match a tumor type to an actual therapy, which then massively increases the chances of cure for a patient. But it also potentially helps the healthcare system because you can determine which patients will respond and which won't respond based on these biomarkers, and that allows you to then target your therapy. Another big use of diagnostic tools is monitoring or prognosis. A great example of this is within the HIV programs, there is a measurement called HIV viral load, which measures the amount of virus circulating in a patient, and it allows us to measure whether the drugs that are being used are doing their job. And this is one of the biggest areas that you see diagnostics applied on the continent. An example from our work is our Global Access Program, where we serve about 10 million patients a year for HIV viral load. And then finally, the last area, and obviously sometimes these things are mixed around, they're not always in this order, is also risk assessment. And we're seeing increasingly the use of biomarkers to determine whether patients are at risk of developing some future disease. So a good example of this is in cardiovascular disease. There are several biomarkers that can predict the risk of developing, for example, heart failure or even bleeding linked to, for example, atrial fibrillation. So there's, as you can see, a wide variety of areas where diagnostics works. And so now, where does data fit into all of this, and where does the digital piece fit into all of this? And I think one of the things that is critical to understand or think about is that diagnostics, as much as we're working in a laboratory and we're working with samples, and it's a very physical kind of discipline, what we're actually generating is medical information or data points. And so I've just kind of used stars along this patient journey to begin to kind of show where there are medically relevant data points. And obviously, each clinical intervention generates medically relevant data. Each diagnostic point also potentially generates this medical data. And then, of course, there could be data points that could be collected between interventions by the healthcare system. And so, actually, when we begin to think about improving the patient experience particularly, but also improving healthcare in general, it's critical that we begin to figure out how to capture and collate and curate all of these different data points, and how do we begin to marry them together in a way that provides a broader picture of the health or the condition of a patient. And I believe that this is a particularly important area that we should be focusing on. And from a diagnostics perspective, because we're generating this very, very important and very powerful medical information, we see our industry as playing quite a critical role in pulling a lot of this together. And we see this happening kind of at two main levels. The one is obviously through the lens of the patient itself. So thinking about how does a patient, think of a disease like diabetes, for example, where a patient may have several clinical interventions over the course of their disease. Each of those interventions generates information which is useful in that acute moment, but then it's also useful longitudinally. So understanding in time whether a patient is able to control their blood sugar, etc., that also provides prognostic information on the long term. But then the other area to think about, and this is where I believe the healthcare system can really benefit, is when we start taking these inputs and these diagnostic touch points and the information we gather from that, and we start studying that data through the lens of the program or the healthcare system. So, for example, looking at HIV programs, being able to really understand what is happening across the population of HIV-infected individuals within a program, and to monitor trends over time, but also to measure costs associated with healthcare, etc., and really to drive all of these things together to enable us to add value. And so, if we think about this, really, we need to be considering a few topics here. The one is really, how do we leverage the information we have on hand to increase quality? So quality in terms of the care that the patient receives, in terms of quality for the healthcare funder, whether that be a private entity or a government, but also how do we leverage this information in the long term to drive down overall healthcare costs, and really to drive then the sustainability of the system. And so I've just put together as kind of a final slide a couple of specific areas that I think we should be really exploring as healthcare workers, but also as private and public individuals who are working in the space of data analytics, information, and how that converges with the practice of medicine and laboratory medicine. And so I think one of the really important areas, and this is an area where I think there's already a lot of work happening, is about enabling communication of information between elements of the healthcare system, particularly on the African continent, where often there are infrastructures, etc. And so here we see, for example, the application at a very simple level of the use of SMS technology for reporting results from the laboratory back to the clinical setting. But then more recently, more sophisticated approaches using mobile phone apps where you're able to push data from the lab directly, sometimes to the patient or to the clinical setting. And from the Roche perspective, we've recently launched a tool for patient management called Etemba Life, which does this exact thing for HIV patients and allows us to really make the patient more involved, really involving them more in their healthcare. And I think this is a critical step, and this is really my second point, which is about how do we enable patients to own and take control of their health. And there's a lot of data that shows that when patients are aware of their health condition, that they begin to take ownership of it, we see lower repeat hospitalizations, we see improved mental health, and we see in time generally improved outcomes, both for the patient and for the healthcare system. And so we need to be building solutions that allow us or allow patients to keep track of their lab results. For example, x-rays, a lot of those technologies are digital as well these days. The actual diagnosis that the healthcare worker provides them, prescriptions, but also educational and awareness materials, so that patients become equipped to look after themselves better. I think another interesting topic linked to this is who owns the data, who really owns the patient data. And, if you think about it in South Africa particularly, often the doctor prescribes the lab tests, and as an individual patient, you go to the lab, they draw your blood. You don't really ever see those results, and you probably couldn't interpret them necessarily if you did receive the result. But at the end of the day, as you perhaps change healthcare providers, or as you move around in life and over time, having all that data and all that information actually is part of your health record, and is something that we need to think about. How do we enable patients to keep track of that? Another interesting element of this is in some African countries, and recently I was in Nigeria, some of the private labs, they actually offer loyalty cards, which is kind of a strange idea. But if you think about it, here, for example, in Nigeria, a lot of healthcare is paid for out of pocket in cash. And so in a way, the result is the tangible good that you receive for your money. And so I think there are some interesting spaces to explore there. The third area is around health data. And I think this is really where wearable tech plays a critical role. So, anyone who's wearing an iWatch right now, especially a newer one, the iWatch is measuring things like your heart rate, the variability between the beats of your heart. It might be measuring your an ECG every now and then. It might be monitoring your blood oxygen levels, and all of this data is quite powerful actually in terms of driving information about a patient's well-being between those clinical points. And I had an experience earlier this year when there was all these terrible COVID waves, where I actually got a message from my phone telling me that I had atrial fibrillation, which is quite a serious condition. And as a result of that, I actually went to a cardiologist, and the cardiologist took the download from the iWatch as data and as evidence for what was on with me. So a very personal experience, but I think a great example of where we should be leveraging this data more and more, and making, I think, a concerted effort to get more people to have wearable devices, particularly where they have chronic conditions. The fourth one is really something which is, I think, on a lot of people have probably spoken about it today or have mentioned it. It's this idea of longitudinal electronic health records. I think at this point we've got a lot of electronic health records. I'm not sure how many of them are truly longitudinal and how comprehensive they are. And I think we, as an industry, we need to work together to be generating a lot more interoperability to really enable all the various service providers, wherever they are, to be providing this quality data into a single electronic health record. And I think there are significant opportunities here for tech companies to partner with governments to begin to build these systems that allow then integration across programs. So, I work a lot outside of South Africa, where you see, for example, in Africa, a lot of these big infectious disease programs that are generating a lot of data. But how do we join all of this together so that we look at it through the lens of the patient across their kind of lifespan? The next one is perhaps then getting a little bit more specific, but really we need to be building collaboration systems to improve clinical decision making. So imagine this is kind of like, in very simple terms, this could be something like a Zoom platform for healthcare workers, right? But then specifically focused on a single patient. And we have an example of a product like this within our portfolio called Navify, which allows all the various caregivers and specialities around a cancer patient, for example, an oncologist or an interventional radiologist or a pathologist, to share all of their medical information about that patient and to then collaborate around the treatment options and really figure out how best to serve a patient through that. So I think we'll see more of these kinds of systems kicking in. Disease management solutions, very broad topic. I think we've seen a lot of this with COVID, simple apps that help us to understand if we're at risk. We see this a lot in diabetes care and other chronic conditions. So really these are tools which I think can evolve to take all these data points, including the data from our smart devices, to begin to build specific solutions for disease areas, chronic disease areas particularly, but things like diabetes, cardiovascular disease, etc. And then finally, I think we need to, and this is perhaps, this is perhaps taking it up a level to a more kind of national level, or at least large-scale level, is how do we build systems to collect, collate, and analyze programmatic or system-wide data, really with the aim of demonstrating value for the interventions. So really, how do we measure whether interventions are adding value to the patient and the system? How do we leverage that data to demonstrate the value that particular interventions are creating, which then allows service providers to extract value from the value stream. But finally, also, how do we then leverage these larger data sets to help to steer and shape healthcare policy? So that brings me to the end of my presentation. I guess perhaps in closing, just to say that I think what's really needed, and when I think from a diagnostics perspective, I think we need to drive more coordination and synchronization between all the health system players, public, private, to really accelerate digital solutions. So think about the caregiver, the diagnostics, all the allied solutions. We need to build better governance models, policy structures, regulatory structures, and legal frameworks to make digital adoption easier. We need to learn iteratively. And then finally, we need to think about all of this through the lens of the patient. At the end of the day, as healthcare service providers, we're always thinking about how we're going to help the patient. And I think if we think about them as the primary recipient of all our interventions, then everything else will follow. So thank you for your attention. I hope it's been interesting. And of course, any questions or comments are welcome. I think you may be on mute. No, still can't hear you.
Hi, Jonathan. Theandrin should be back shortly. Yeah, that's why he was struggling a bit with the mic there.
Mm-hmm. Right. So I see a question on the chat, which I'll go straight ahead and answer. So, yeah, how do we create that collaborative environment? And I think that's probably like $1 million question, but I think it starts with the creation or the acceleration of industry bodies, and this is something where I realize that sometimes we tend to work within our discipline. So, if I think of our industry, we have the South African Laboratory Diagnostics Association, and all of those meetings are only diagnostics companies. And we might think of something like SAMED, which is the medical association. But I believe one of the areas we can work is to create more cross-functional industry bodies or industry activities like this one, where we can begin communicating and connecting across across different industries. Another area, and we do this a lot internally, is we do a lot of education, and we bring often particular key opinion leaders together into various forums where they can talk to each other across the public-private kind of split. But I do agree with you. I think this if we solve this question, then I believe the whole industry will really be able to get a much better view. And perhaps this is something also for someone like IT News to also think about. How can they support us as an industry to create these forums?
Hi, Jonathan. Can you hear me now?
Yes, I can hear you loud and clear now.
Yes, apologies for that. I've just had to join from my phone. For some reason, it's asking me to reboot my PC. So thank you very much for that presentation. I think the one question that I wanted to pose was to say, when you start looking at this longitudinal data analysis, how do we potentially look at using information that's coming directly from the patient through their various different stages of lab results that you've shown in your one slide, and supplementing that with external information and external data sources that can enrich a report that provides a lot more meaningful sense to the patient, because they can understand what is being depicted in that lab report rather than just a pure sort of diagnostic report that states what their certain levels are, and also that it helps the physician in the consultation to actually remedy and isolate what the underlying problems could be.
Yeah, sure. Great question. I think this can be approached from two sides. The one would be to approach it from the patient side. So thinking about apps, for example, that already consolidate information. For iPhone users, it's the health app, for example. If you actually scroll around in there, it's amazing how much information is being gathered. Some of it is kind of gathered continually. Other of it is you would trigger its collection. So I think there's an opportunity there for app developers on one side to build tools that allow us to visualize that data better. The approach that we've taken from the industry perspective is to go the other way around, which is to look at this through the lens of a single disease or a single health situation. And what we're starting to do is build what we call integrated end-to-end solutions, which allows us to think about what are the interventions that are needed for a certain disease, and then to partner with multiple service providers to build digital tools, often which would focus on a single disease entity, like something like stroke or atrial fibrillation or diabetes or cardiovascular. So we're beginning to build these solutions that allow us then to supplement the data that we're generating in a laboratory, along with data that a clinician is generating with day-to-day monitoring of the patient using a wearable. It might not be a smartwatch or something like that. In most of the cases here, we're looking at things like remote blood pressure monitoring, or measuring parameters like blood glucose, which is not completely fully automated, but creating then platforms that allow patients to input the data that they generate themselves, as well as data on how they feel. So really trying to measure patient outcomes. How does a patient feel? Are they feeling better today than they did yesterday? And if they're feeling significantly worse, could that be a trigger point for them to return to the healthcare facility? And so we've got a couple of examples from around Europe, particularly. We're starting to build a few locally of using this kind of single disease approach to solve this problem. Ultimately, in the long run, we would want to then join all these together to create a kind of a longitudinal approach, but it's early days.
All right, no, perfect. Thank you very much, and thank you for your time today and the presentation. Very, very insightful.
My pleasure, and thanks for the opportunity, and wishing everyone a great afternoon further and a great day tomorrow with day 2.